Hi, it's Dr. Pierce-Bergen from Air Medical Solutions coming to you today to talk about pilots with migraine headaches. Now, what do you need to bring to your air medical examiner and what are they looking for? Well, in particular, you typically have a treating physician who treats your migraine headaches. And we do need a statement from that provider stating that everything is going well, whether or not they made changes to your medications recently, and whether or not you're having any side effects from those medications. We also need to know the diagnosis of the type of migraine headaches. So classical migraine headaches, cluster headaches, as well as chronic tension headaches are all okay in terms of migraine headaches. If there is other headaches in terms of the name of ocular migraine or complicated migraine, we do need to look into those a bit further. We also need to know how many exacerbations have you had? Are you typically having more than one a month? Have you been hospitalized in the last year? Or have you required an urgent care or primary care visit in the last year at least more than 2 times to be treated for an acute exacerbation of your migraine headaches? These are things that we do want to know in terms of medical management. There are certain medications that you use for migraine headaches. One, we look at preventative, and the other we look at abortive. There are certain medications that are preventative that we do allow and do want to know about, calcium channel blockers and beta blockers being some of them. Abortive therapy, you do need to know that those are an acute, take it as you need it within the first 2 hours of having a migraine, that type of medication. However, there is a no-fly time period after taking those. For instance, the sumatriptans are 24-hour no-fly, the Reglans are 36-hour no-fly, as well as the Phenergan is a 96-hour no-fly. So if you just take your triptan, then you're just looking at a 24-hour. Many people combine that with the anti-nausea like Phenergan, and you're looking at 96 hours of no-fly time. Now, there are certain symptoms that are not acceptable with the FAA or do require further evaluation. And those are typically TIA, like stroke-like symptoms, okay? Those do require further evaluation, as well as vertigo or dizziness, syncope, where you feel like you're gonna pass out or have passed out, as well as any mental status changes. So in general, the frequency, the types of medications, the duration have you been on these medications, any changes to your medications, whether or not you've been hospitalized or urgent care outpatient visit are very important for your air medical examiner to know. And typically what can be approved, if all of those are on the straight up and up, then your air medical examiner can approve you with a CACI. If there's any of those abnormalities that I talked about, to include the ocular migraines, to include vertigo, syncopal episodes, vision loss, things like that, like a TIA, those do require further evaluation and will be deferred to the FAA. All right, I hope you have a great day. Bye-bye now.